Hello and welcome to the MHS Tips, Updates, and Reminders presentation from MHS or Managed Health Services. On our agenda today, we will be discussing MHS provider claims issue resolution process, discuss our MHS secure web portal enhancements, which will kind of go hand in hand with that provider claim resolution process. We'll discuss the emergency room prudent layperson review, discuss our prior authorization reminders for you, and then go over the MHS provider relations team. So discussing MHS provider claim issues resolution, we have three main steps involved in this with MHS. Step one would be our informal claims dispute or objection form. Step two is going to be our formal claim dispute or administrative claim appeal. And step three would be arbitration. For any assistance or questions after completing step one or any of the other steps, you can contact our provider services phone and do a request that way, or sign on to our secure web portal and use our secure messaging tool. And if any additional assistance is needed after step one and after you've called the provider services line or used our web portal inquiry, we do have provider relations regional mailboxes that our internal reps do monitor, and you can email those, and we'll be discussing those also today. You as a provider may call to inquire about your claims. However, calling MHS will not serve as official notice to MHS of a dispute or appeal on a claim. It's not going to stop that 67 calendar day count from the date of your explanation of payment to file that written informal claim, dispute, or appeal. So discussing step one, our informal claims dispute or objection form. Those must be submitted in writing within 67 calendar days of receipt of the MHS explanation of payment or EOP by using the MHS informal claim dispute or objection form available on our website, and we provided the link here for you to go to our forms section. There is going to be a general form for medical, and there's also a separate form for any behavioral health claims issues. And the address for submission is listed on each of these forms. Just wanted to remind you that any request received after that 67-day window will not be considered by MHS. Here we provided a screenshot of what our informal claims dispute or objection form looks like for the medical side, and provided the address. It's going to be Managed Health Services, PO Box 3000, Attention Appeals Department in Farmington, Missouri. And once again, the link here has been provided directly to that form for you. And here's our separate form for behavioral health. You'll notice the address is different. It is a Behavioral Health Services, PO Box 6000, Attention Appeals Department in Farmington, Missouri. And the link here for the behavioral health objection form is provided also. So for step one, or the informal claims dispute or objection form, you'll want to submit all your documentation that's going to support your objection. That's going to include copies of the original MHS EOP showing how the claims and questions were processed, any copies of any other subsequent MHS EOPs or other determinations on the claims or claims in question. You want to provide also any documentation of any previous attempt you've made to resolve the issue with MHS, and any other documentation that supports a request for reprocessing or reconsideration of the claim. MHS is going to make all reasonable efforts to review that documentation and give you a response within 30 calendar days. However, if you don't receive a response within that 30 calendar days, you as the provider should consider that the original decision was upheld, and at that time you'll have up to 67 calendar days from the date of the dispute response to initiate a formal claim appeal, which is step two that we'll be discussing. Some tips: when you're disputing multiple claim denials, you'll want to submit separate informal claims dispute forms for each member experiencing that denial. You'll also want to provide additional information such as what the denial code was that MHS used and the description found on your explanation of provider payment or remit. Briefly describe why you're disputing the appeal. If you do have multiple claims, please either list all the claim numbers on the form, or in the reason for dispute section, state the member's experience and denial reason and provide that denial reason code for all claims for date of service and put your date of service range, and then ask to review all those associated claims. And also, as a reminder, you want to save a copy of all your submitted informal claim dispute forms. So once you've done that, you can utilize our provider services phone request or our web portal inquiries. Once again, it's not considered a formal notification of provider dispute, but that step one was. And that's why we ask that you do step one first. Any claim issues presented by providers to our provider services phone line or web portal team for review are going to be logged, and they will be assigned a ticket number, and they'll provide that ticket number for you. Please keep this for your reference. Our provider services line is open from 8 a.m. till 8 p.m. at 877-647-4848. And here we provided the login link to log into our secure web portal and use the messaging tool. Some helpful tips when contacting the customer service provider services line or our web portal team. If you're disputing multiple claims, you'll want to provide that provider service rep or portal team member with one claim number as an example of the specific denial. You want to tell the rep that you have a claim research request to review all claims for that specific denial reason. You'll also want to state if this denial is happening for one or multiple practitioners within your group or clinic, and if it is multiple, please provide the tax ID number. You want to provide the MHS denial code and description found on your EOP, and briefly describe why you are disputing this denial or seeking research. You do not want to include multiple claim denials within the same research request, however. You'll want to submit separate research requests for each individual denial reason. And we ask if you please refrain from submitting research requests for vague reasons, or if you can clearly determine that the denial is valid. For example, a valid timely filing denial, or if it was a service that required prior authorization, but prior auth was not obtained. And once again, retain all those reference numbers provided to you by the provider services and web portal teams. Research can take up to 30 to 45 days. At any time, you can follow up with the provider services team or the web portal team with a status request. Just provide that original reference number that you were given. So now we're going to discuss our provider relations regional email boxes. If step one you went through and the denial was upheld, and then you called provider services or used our portal team and they didn't resolve that issue within 45 calendar days, we now at MHS have a regional provider relations email box for each region, and you can utilize that. Your issues were going to be logged by our internal provider relations team, and providers will receive a response email with the next steps and any assigned reference numbers. Response to incoming email can take 2 to 4 weeks depending on the workload. We do ask that you do not email your provider partnership associate or your provider relations rep directly, as this may delay the time in getting a response due to that team is traveling, usually during the week, 3 or 4 days. So that's why we started the provider relations internal team. They are sitting there Monday through Friday monitoring those email boxes, so you'll get a quicker response by utilizing those. Some tips when you're submitting to our provider relations regional email boxes. You must submit the following information to that regional email box, and you can attach a spreadsheet if multiple claims are involved, but the below fields must be included on that spreadsheet. You want to do any of the issue reference numbers that you have previously, the tax ID, your group or facility name, the individual practitioner name and NPI, the member name as well as the RID number, what product it's for, any claim numbers that are involved in that, your date of service or date of service range if it's multiple denials. If the issue is related to claims being denied for no authorization, you want to provide the related prior authorization numbers. and of course the reason for your dispute. Here we provided each of the provider relations regional mailboxes. They match the map for the provider relations team. So we have the Northeast region, then there's a Central region, the Northwest, Southwest, and Southeast, and then we have a certain group of providers that are considered the Tier 1 providers, and there we have provided those email addresses for you for each of those boxes. Just want to take notice that for like the Northeast region, for example, that email is MHS_provider relations _NE@MHSindiana.com. It is very important that you use those underscores or we will not receive that email. So moving on to our administrative claim appeal, or step 2, this is going to be a continuation of step 1. In the event that you're not satisfied with your informal claim, dispute, or objection resolution, you can file an administrative claim appeal. That appeal must be filed within 67 calendar days from the receipt of the informal dispute resolution notice. An administrative claim appeal must be submitted in writing on company letterhead with an explanation including any specific details which may justify reconsideration of the disputed claim. The word appeal must be clearly marked on the letter, and those administrative claim appeals need to be mailed to Managed Health Services, P.O. Box 3000 in Farmington, Missouri. And here we provided you the link for our MHS provider manual, and you can utilize this manual and check Chapter 5 for our claim administrative reviews and appeals for any additional information. And then step 3 is going to be the arbitration. In the event that you as the provider are not satisfied with the outcome of the administrative claim appeal process, or step 2, then you may request arbitration. Claims with similar issues from the same provider may be grouped together for the purpose of requesting that arbitration. And to initiate arbitration, the provider needs to submit a written request to MHS on their company letterhead, and the request must be postmarked no later than 60 calendar days after the date the provider received MHS's decision on that administrative claim appeal. Those arbitration requests need to be mailed to MHS Arbitration, 550 North Meridian Street, Suite 101 in Indianapolis, Indiana, unless you're otherwise directed in the level or the Step 2 Administrative Claim Appeal Process Denial Letter. And once again, we provided you the link for our provider manual, and you can check out Chapter 5 for Claim Administrative Review and Appeal for more information. Now moving on to our MHS Secure Web Portal, we have had some enhancements, and one of them is going to go hand in hand when we start discussing it with the Step 1 of our previous claim dispute issue resolution process. So some of our portal enhancements: you can manage your claims more efficiently with easier online claims and tracking. You can see which have been approved or denied with our new color-coded tracker. The great change that's coming through, as we discussed in Step 1 of the claim issue resolution process. If you remember, I had said that those need to be submitted in writing. Well, as of April 3rd, MHS has added the informal claim dispute and reconsideration process is now online. You can now send your disputes online and attach your documentation, and you can opt in or out for status change emails. Your submissions, however, still need to be made within 67 calendar days of the date on your EOP. You can also quickly check member eligibility with our new overview page. You can see all the important member data on one page. And we've added a helpful reminder to our prior authorization tool with a pop-up window when you're doing a prior authorization to prompt you to attach supporting documentations, and that will help avoid any delays in your prior authorization request. If you have any information that you would like additional training on, you can contact your provider representative, and we're going to be happy to help you. A little update for our urine drug screening is next. The purpose of drug testing is going to be to monitor a patient's compliance while taking a controlled drug or drugs and to identify drug abuse prior to or during controlled substance therapy. Presumptive tests do not need to be prior authorized. However, confirmatory or definitive tests do require prior authorization. All these requests must be medically necessary. There is not a time frame given as to when it should be done, but it is going to be based on that medical necessity. The requested confirmatory or definitive test is only for the specific drug or number of drug classes, which preliminary analysis has yielded unexpected results. So it does need to be for a specific drug and not a multi-panel test. MHS clinical policy for the outpatient testing for drugs of abuse does not allow providers to require MHS members to submit to urine drug screenings unless specific requirements are met. The plan also prohibits the screening of MHS patients at every office visit. And here we provided the link for you for the clinical policy to help you determine when confirmatory urine drug screening is appropriate. Moving on to emergency room prudent layperson review, MHS did implement this on February 1st of 2020. If you as the provider believe that a claim paid as non-emergent should be considered as emergent, the provider can submit medical records along with a request for a prudent layperson review. As of April 1st of 2020, MHS did adopt the state auto pay list and implement the review of the first 6 diagnoses to determine if the claim will pay emergent, and we've provided you a link here to that auto pay list. Your PLP reviews or prudent layperson reviews should be submitted by attaching an MHS informal claims dispute form, clearly indicating that prudent layperson review along with the medical record is requested. Those requests must be submitted within 120 days of the claim adjudication date, and those reviews should be sent to MHS at P.O. Box 3000, Farmington, Missouri. Once that prudent layperson review is completed, providers will be notified of the decision via their explanation of payment. Claims that deemed emergent will be reprocessed at the emergency level of reimbursement, including ancillaries, with an EOP code of EXUN, which will also state PLP met or prudent layperson met. Claims deemed non-emergent will remain reimbursed at the screening fee only, with half applied as appropriate, with an EOP code of EXAS. And the description for that code is based on review of medical records, PLP emergency definition not met. So moving on to some reminders that we just have for our prior authorization. As of July 1st of 2019, MHS began a prior auth program through National Imaging Associates, or NIA, for the management of physical medicine services, which include physical therapy, occupational therapy, and speech therapy. Any services rendered on or after July 1st, 2019 will require an authorization. However, there is an exception if it's therapy provided in a hospital emergency room, inpatient or observation status, acute rehab hospital inpatient, and any inpatient, outpatient skilled nursing facility settings will be excluded from this program, so prior auth will not be required for those therapies if you're in those settings. A big reminder here, an update, is that if you are a chiropractor and you're rendering any therapy services, you are exempt from the NIA program and do not require prior authorization. So if you are a chiropractor that's giving physical therapy, you do not need to request prior authorization. Moving on to our durable and home medical equipment, MHS has that managed by Medline. And how this works is that members and referring providers do not need to search for a DME provider or provider of medical supplies to service their needs. Medline's web portal is used to submit those orders and track the delivery. However, this does not apply to any items provided by and billed by a physician's office. So if you are a physician's office and you have someone in there and you provide the crutches in your office and you bill for those through your office, you do not need to submit requests through the Medline web portal. We do have specific exclusions applicable to specific hospital-based DME and HME vendors. So requests should be initiated via the MHS Secure portal. And through our web portal, you would simply go to mhsindiana.com, log into the provider portal, click on Create Authorization, then you'll click on DME, and then that will direct you to the Medline portal for order entry. I do want to stress that this is the preferred, quickest, and easiest way to submit is through the web portal. But they also have capability to receive those via fax at 866-346-0911 and also over the phone at 844-218-4932. Outpatient radiology prior authorization. MHS has partnered with National Imaging Associates, or NIA again, for a high-dollar outpatient radiology prior auth process. These are going to be high dollars such as your MRIs, MRAs, CT scans, and PET scans. PA requests must be submitted via the NIA website at radmd.com. And then there's the phone number of 866-904-5096. This is not going to be applicable for any ER or observation requests, however. So moving toward our orthopedic and spinal surgical procedures, MHS has partnered with Turning Point Healthcare Solution to manage our prior auth for medical necessity and appropriate length of stay when applicable for services that we're going to list below and on the next couple slides through MHS existing contractual relationships. So for prior authorization will be required for the following musculoskeletal surgical procedures. So I'm not going to read through these all for you, but as you see, it's arthroplasty, any knee replacements, rotator cuff repair, some hip resurfacing, some ankle, shoulder, and wrist fusions. And that's going to be for the orthopedic surgical procedures. For spinal surgical procedures, those are going to include your spinal fusion surgeries, such as your cervical, lumbar, thoracic, sacral, or scoliosis, any disc replacement, implantable pain pumps, some spinal cord neurostimulators. So if you're having any of these procedures, those need to be auth through Turning Point. Here we provided Turning Point's information for you to request that authorization, referred through the web portal intake at myturningpoint-healthcare.com. They also take telephone intake at 574-784-1005, and their fax intake is at 463-207-5864. For inpatient prior authorization, MHS no longer accepts phone calls and only accepts notification of an inpatient admission via fax, utilizing the IHCP Universal Prior Auth form, or via the MHS Secure Provider portal. And once again, we've provided that link here to log into our provider portal. You want to submit timely notification and clinical information to support an inpatient admission via fax to 866-912-4245 or upload that to our Secure Provider portal. Moving on to some behavioral health, limitations on outpatient mental health services. MHS has decided to follow the IHCP Mental Health and Addiction Limitation Policy, or the CPT codes listed here on the screen, in combination. They are going to be limited to 20 units per member per provider for a rolling 12-month period, and that 12-month period started on 12/15/2019, and it's going to start over on 12/15/2020. And here we provided you the codes this affects and also the description of those codes. Per provider is defined by MHS as per individual rendering practitioner NPI that you're billing on the CMS 1500 claim form in box 24J. If the claim, once it's adjudicated, is determined to exceed the limit, it's going to have the denial code of EXMB, which means maximum benefit reached. If the member does require additional services beyond that 20 unit limitations, providers may request prior authorization for additional units. Approval is going to be given based on the necessity of the services as determined by the review of the medical records that you've submitted. You as the provider will need to determine if you have provided 20 units to the member in the past rolling 12 months to determine if a prior auth request is needed. So now I'm going to go through our MHS provider relations team. Hopefully most of the providers know who their provider relations rep is, but if not, we do have a map available, and I'll be going through this. For the Northeast region is Chad Pratt, and his contact information is listed here, as well as the regional email box for Northeast region. Currently in the Central region, we do have an open position, but please stay tuned. We have news coming soon who the new representative will be. For the Northwest region, your provider partnership associate or provider network territory is Candace Irvin, and her contact information is listed also. For Southwest region, you would have Don McCarty, and for Southeast is Carolyn Volakovic Monroe. And then for our Tier 1 groups, if you're in the northern part of the state, and you're one of these groups that are listed here, it would be Tawana Danzy. So if that one of your groups is listed under Tawana's name, that's who your provider representative would be. And for the central and southern part of the state, Jennifer Garner is taking care of these groups also. We also have our internal representatives information here, and we've also provided for any dental providers the provider relations specialist for Involved Dental. That does conclude the presentation today, and I do want to thank you all for joining us today, and thank you for being our partner in care. And if you would like to reach out to any of the provider relations representatives for your area, we'd be happy to come and meet with you and do any additional training.